Hello friends, myself Dr. Sunil Tanvar, Director Jaipur Durbin Hospital and Nux Rhinoplasty Jaipur. I'm also the Founder Secretary of Rhinoplasty Society of India. And friends, since last so many days, I realized there is a lot of I got lot of emails, calls from my junior colleagues. Then they asked me then which book of the rhinoplasty is good and which course is good, how they pursue, how they become a good rhinoplasty surgeon, how they start the career. So that I realized that why not we have a systematic approach. So today we discuss that how you become a start your rhinoplasty career. So in my I think that 12-year rhinoplasty career, I personally realized that that there is nobody there is lot of plastic colleagues and ENT colleagues. They want to pursue their career in the like the ENT colleague in the skull base and the endoscopies and the head and neck, and there is very few guys they want to become a career in rhinoplasty. So I realize why, because there are I think I personally realize there are some certain challenging factor in the rhinoplasty really. So I just summarize the three important challenging factor that usually we have in the rhinoplasty surgery. So the first challenging factor in the rhinoplasty really that is the endless anatomical variation of the nose really. Nose have the endless anatomical variation, so you need a lot of comprehensive knowledge of uh, anatomy, 3D anatomy of the nose, just to correct the abnormal anatomy. You identify abnormal anatomy. Second, the important challenging factor that the rhinoplasty is a balance between the cosmetic and the functional aspect of the nose. Suppose you give a patient is a very beautiful nose, but the if the functional aspect is not good, and it's very difficult to satisfy your patient. And then the third, your result match with the expectation of the other mind. So these three challenging factors really rhinoplasty surgery make a complicated surgery in the rest of the all facial plastic surgery. So I think for simplification of the learning, uh, I think you should have a systematic approach. In the systematic approach, I think we just discussed the 5 important steps. Then you start your rhinoplasty career. First, I think the after the post graduation, that is the best time if you want to pursue. You learn the rhinoplasty, because after that there is a lot of responsibility for the learning, for the courses. So after the post graduation, if you think that I want to become a rhinoplasty surgeon and I want a career in rhinoplasty surgery, so that is the best time. Rest on up to you whenever you feel. Then whenever you feel like I want to become a rhinoplasty surgeon and I start my career in rhinoplasty surgery. So the first step, first you should have a mentor, you should have a guru, you should have a teacher. I think you choose one of, like in every field there is renowned teacher, like for the skull base, the Janki, Dr. Satish Jain, and lot of others. So first you choose, you have a teacher, you have a mentor, you have a guru. So whenever you feel the problem, then you contact, then you just describe your complications, and you whenever you need the guidance, then you call him. So first step, then you have your teacher and the mentor. Then the second step of the learning rhinoplasty, that is you read the good books, and in good books first you complete the one book. There is lot of literature, lot of books in the rhinoplasty. So first you read the one book, and I read lot of books in the rhinoplasty, but my junior colleagues, I think the Rollin Daniel is a good book. Rollin Daniel have the two book. One is the Rollin Daniel Atlas, and one is the Rollin Daniel textbook. First, you purchase the Rollin Daniel textbook, not the Atlas book, so that the language of that book is easy and is a basic book. So at least 2 or 3 times you read that book, okay? And then another is a very important book, that Rhinoplasty Dissection Manual of Dean Torumi. The Dean Torumi Dissection Manual is also a wonderful book. It's a very good book. From page 1 to the last page you read 2 or 3 times. So first you read all terminology, all basic steps, all deformities of the nose. So first you learn the basic. So this is the second step. Never jump one and another books, more and more books, only the 2 books, okay? Then the third step, you watch the videos. You watch the videos. Now how you watch the videos? Not like the entire rhinoplasty. In your beginning days, first you watch how you open the nose. Again and again, how you open the nose. Then how you harvest the septal cartilage. Then different type about the osteotomy. You see the lot of osteotomy videos. Then about the spreader graft fixation, just like the mid-vault restoration. And then about the tip modifications. You learn the basic steps in the video watching. So you watch the video whenever you're free. Then in this era we have a lot of videos available in the YouTube. So this is the third step. Now the fourth step, you just go for the cadaver dissections. You just go for the cadaver dissections. I attend lot of cadaver course as a participant and as a tutor also, as a demonstrator also. I realize the participant, what they do, just go there and they cut and the cadaver, and in the half an hour complete my cadaver dissections. No, friends, this is the not way. The basic learning, first you read, you make some steps in your mind, then what you want to learn from your cadaver. So first, entire surgical landmark, first you mark with your hand, you learn, you feel, you touch the all surgical important landmark. You learn, you mark the blood supply of the nose. Then some important step of a basic rhinoplasty, like first you just try how you infiltrate in your patient. Then how you expose this soft tissue envelope, how you deglobing over nose. So you learn different type of the incision, like how you make a transcolumella incision, what is the exact site of the incision, then how you made the marginal incision, okay, and then how you expose the tip, mid-vault, dorsum, and then how you expose the septum. Because particularly my plastic surgeon colleagues, they have little bit difficulty when dealing with the septum, because they are not used to for that. So you particularly how you deglobing, what is your sequential step of deglobing of the septum, and then how you reconstruct again the anterior septum by the caudal septal extension graft or by the columella strut or something. And then osteotomy steps, you learn the osteotomy steps. So how you learn the osteotomy step? Because once first you know about the different type of the osteotomy, about the different type of the knowledge of the osteotome. First you have you about the theory in your mind about the this entire bony vault, different about the bone of the nose, that this entire nose pyramid consists by this and this bones, and different attachments, and then about the types of the osteotome, indication of the osteotome, sequence of the osteotome, and then you learn about the basic steps of the tip, like how you fix your columella strut, what is the length of the columella strut, and then different type of the tip sutures, basic the steps of the, then you also learn the advanced step like the tongue in groove, like the lateral croissant, ella batten graft, rim graft. These are modified tongue in groove. These are the advanced steps. So first you all these things in your mind. Okay, so this is the basic learning in a cadaver dissection course. So this is the fourth step. Now the fifth step is the hands-on learning. Friends, once you come by the first, second, third and fourth, this four stair step pattern, first you cross all these, then in the fifth is the hands-on under a good instructor. And whenever you go for the hands-on, then the most important thing, never jump on the for the hands-on. First you realize, first you observe your teacher, your master, your professor, your instructor, how he hold the instrument, how you use the instrument, how you put the instrument, the observation. Because mostly I realize in my fellowship course also, there are a lot of participants, they think just they believe in doing, they never observe. I think you should first observe the things, because sometimes when you have such type of the habits, then you physically present but mentally absent. Each and every, when someone other do the case, then you observe about each and every steps, and then once you learn each and everything, then you start the rhinoplasty independently. So this 5 step, this punch, like first you just go, you make a mentor, a teacher, a guru. Second, you read 1 or 2 good books. 2 books, one is the Rollin Daniel text, one is the Dean Torumi dissection manual, and third, watch the YouTube video in the systematic manner, and fourth, then the cadaver dissection demonstration, hands-on cadaver, and fifth is the hands-on. Then you start your rhinoplasty career, and then you realize your comfort zone also. In the beginning days, my friends, you attempt only your comfort zone case, because if you do the successfully a case, then you build up your confidence. But if you attempt a advanced case, your beginning case, and then the patient if not satisfied, then he create the problem, he create the nuisance, and you lost your confidence. So you find you learn your comfort zone. In that comfort zone, you start your rhinoplasty practice. So these are the basic steps and how you start your rhinoplasty practice. So friends, I think this video is useful for you, and you just can share to your other friends also. And in the next video we discuss, then once you start the rhinoplasty, how you improve your rhinoplasty skills, how you learning, what that step, then we can learn more and more. So in the next videos we discuss about that, and you just find where the best courses regarding the hands-on, regarding the cadaver dissections, you join that, and then you start. Rhinoplasty is a very good subject. If you do properly, then it's really rewarding. Otherwise, everyone you know that rhinoplasty is really the challenging factor. So definitely we will meet in the next video regarding how you improve your skills of the rhinoplasty. Thank you for watching.